Hello, my name is Katie Byes, and I'm going to be talking about how phenomenology influences nursing knowledge development and theory. This brief timeline shows the contributions of philosophers of phenomenology as well as nursing's use of phenomenology in research. As you can see, the four main philosophers came several decades before nursing integrated phenomenology into its literature in the 1970s. In this talk, we will discuss the following advancements: Jean Watson's seminal text and her theory on caring in nursing from 1979, Patterson and Zetterard's meta-theory of humanistic nursing from 1988, John Paley as one of the first to criticize the way nurses applied phenomenology, and Max van Meenen's methodological guidelines for phenomenology, both from 1997, and Rosemary Rizzo Pars's human becoming theory from 1998. Proponents of the use of phenomenology in nursing research say that phenomenology is used in nursing to help us understand the lived experience as is related to illness and suffering, while not overlooking the uniqueness of the individual. It can help us identify new ways of thinking about nursing practice that empiricism cannot. It can be applied to clinical nursing. Later we will talk about the nurse-patient dyad. It can be applied to nursing education, and it can be applied to the struggles of patients or how illness affects certain life phenomena. There are several ways we could use phenomenology in nursing. We could explore phenomena experienced by the patient. Some examples of how this has been done are by using phenomenology to elucidate the feelings patients experience after enduring postpartum depression or myocardial infarction. We could explore phenomena experienced by nursing students, such as their feelings about going through a particular program, such as an RN to BSN program. And we could explore phenomena that the nurse as the clinician experience, such as how they approach patient encounters, whether their relationship with their patients is sensitive, intimate, or sentimental, as has been studied in the past. Jean Watson's seminal work, Nursing, the Philosophy of Science and Caring, is grounded in phenomenological concepts of freedom, subjectivity, intersubjectivity, and the meaning of experience. Her theory on caring included the assumptions that caring can only be demonstrated person to person, and that caring is more healthogenic, or good for one's health, than is actual curing. She identifies 10 primary curative factors involved in nursing care. One is allowance for existential phenomenological forces. Others include assistance with the gratification of human needs and instilling in one's patients faith and hope. Patricia Benner says that phenomenological research can inform and improve individuals' nursing practice. Her work elucidates the stages nurses go through as they obtain more knowledge and clinical experience with nursing. Her novice to expert model is helpful in teaching new nurses how they can anticipate learning in their role as clinicians. Benner also used Heidegger's principles of phenomenology to view the effects of stress on an ill patient. Patterson and Zetterard's humanistic nursing theory puts the nurse-patient interaction, or the intersubjective transaction, at the center of the nurse's role. Their theory says that the nurse-patient dyad exists as part of the larger world. The act of nursing is the lived dialogue that exists between them. They propose that this nurse-patient relationship can be better understood through phenomenological research. The meta-theory of humanistic nursing can be a means to describe daily phenomena that occur regarding nurses. Max van Meenen was the first to elucidate how phenomenology should move from a philosophy to a means of conducting scientific behavioral research, and thus be better equipped to inform nursing knowledge. His methodological guidelines are that the researcher should start by selecting a phenomenon of interest, then investigate the experience as it is lived rather than as it is later perceived. He believes that the researcher must become immersed in his subject and that researchers must be committed to the phenomenon in order to study and write about it accurately. Next, he should reflect on the essential themes of the phenomenon, write and rewrite to accurately describe the phenomenon, and stay connected to the phenomenon, and finally, consider the interplay between parts and the whole research context. Rosemary Rizzo Pars's human becoming theory is founded on the work of the phenomenology philosophers Heidegger, Sartre, and Merleau-Ponty. Its three constructs are meaning, rhythmicity, and transcendence. According to this theory, the human's meaning is obtained through lived experiences, as he or she, together with the environment, co-creates what is real for him or her. Rhythmic patterns of relating to others exist in the apparent opposites of revealing, concealing, and enabling, limiting, of connecting, separating. Transcendence is the individual's ability to move beyond the current moment and create a path for him or herself in the midst of ambiguity and change. John Paley is one of the harshest critics of using phenomenology to speak to nursing knowledge. He says that nurses struggle with phenomenology because it is not objective or causal, nor is it evidence-based. It is impossible to bracket or lay aside preconceptions, he says. He asserts that objectivity is not about laying aside prejudices, but about using universally agreed protocols or standards. Faith will address these concepts more as she talks about research in the next section. Paley's fallacy of implicit generalization addresses nursing researchers who say that findings cannot be generalized, but then go on to make recommendations or assertions based on their findings. Because phenomenology sample sizes are usually very small, often with only 6 to 12 participants, and often from a single institution, they cannot be representative of the entire population. Paley writes that one cannot describe the essence of a phenomenon just because several authors have identified a similar finding in their studies. Instead, findings reflect the essence of a person or group's unique experience. This is specific to the person or group and cannot be generalized or of use to others. How has nursing defended their right to use phenomenology to Paley and other critics? Vicki Earle proposes that phenomenology has different meanings. It may be theoretical, as it was for Heidegger and Husserl, who wrote of it in a strictly philosophical sense that did not address how it should be applied to scientific research, or it may be practical, as it is typically used by nursing. Additionally, Charlotte Delmar writes that deeper meanings can be given to phenomenology by applying theory and empiricism to results obtained from phenomenological inquiry. Next, my colleague Faith Cosby will take us into a more in-depth discussion of how phenomenology has influenced nursing research and evidence-based practice.